Well, good morning, everyone. Welcome. Thank you for tuning in to WHLI Talk Radio. I'm Dr. Victor Politi. I'm the president and CEO of New Health. That's Nassau University Medical Center over there in East Meadow on Hempstead Turnpike. So as healthcare in America is changing, New Health is part of that change. This half-hour program will provide you with the essential information about our services and facilities that provide top-quality care that fits into your lifestyle. So New Health's roots go deep into Long Island history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver excellent essential care to everyone at every stage of life. So we're absolutely dedicated to being the healthcare institution that makes a full spectrum of world-class services available to all of Nassau County residents. Our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. And every day there's something going on at our hospital over there at Nassau University Medical Center. Right now we're completing a $24 million brand new primary care center on the first floor that's going to provide pediatric, obstetric, and medical services to patients, really upgrading the services and technology in that hospital to real state-of-the-art care. The emergency department, it's been about 2 years now, $38 million to rebuild that ER, a level 1 trauma center. Every room is individual private rooms with televisions. We have 2 operating critical care units in there, a trauma room in there. I mean, a really state-of-the-art emergency room, all board-certified ER docs, some of the best physicians around, trauma surgeons, orthopedic surgeons, cardiologists. So we basically handle just about anything that comes in that door, or by ambulance or by helicopter. We have 2 heliports, and the helicopters are always bringing in really critical patients from throughout Long Island to us. We are the specialty center. We have the burn center up there for the firefighters or patients that are burnt in a fire or have overcome by carbon monoxide or other types of gas. We have that burn unit. Hyperbarics. We have this very large multi-place chamber. The only other one is up in the Bronx. At Jacoby has one for patients with hyperbaric medicine with carbon monoxide poisoning or diving injuries. The services that are provided at Nassau University Medical Center is amazing, and I've been there a year and a half now as the CEO, and it's just constantly amazing. And one place that I really love to show off, and I speak a lot about, and if there's any place I get a lot of letters from, constantly, I wouldn't say probably every day, someone's writing me a letter thanking me about the care that they received, about the patients, about the nurses, about the physical therapists, about just everything that's going on, and that's in our Department of Physical Medicine and Rehabilitation. These are our occupational therapists, our physical therapists, speech therapy. These are our physiatrists, and I know I'm saying that wrong for all you classical physiatrists out there, but it's the physicians, the MD doctors that work together in patients that have had a car accident with multiple trauma, or patients who had a stroke and need to learn how to walk again, or people who had some sort of debilitating disease and they don't have to eat and to do things. Well, on our 5th floor is our Department of Physiatry, our Department of Physical Medicine and Rehabilitation. And the things that I see on there, if you're ever at the hospital, I want you to walk through and take a look at that. A state-of-the-art physical therapy facility, all brand new, beautiful, big, open, airy. We even have a room there that is it's modeled after a house. It's got a bedroom, it's got a kitchen, it's got washing machines and dryers and a Mr. Coffee machine and an alarm clock, so that if someone has had a stroke or some other problem, they can actually sit there and, with our help, learn how to go back into their home again and be able to live their life after a stroke. We have a little supermarket area that they have with cabinets and, to teach people how to reach up to the, get stuff off the higher shelves and ATM machines. So I mean, I think it's really a remarkable place. So today on our show, which is Health Talk, we try to bring in, people that, that you want to hear about, services that we have at Nassau University Medical Service that you don't realize we have. So today we bring in Dr. Adam Isaacson. Dr. Isaacson is an MD. He's a physiatrist. MD or DO, Dr. Isaacson?
MD.
MD, who's a physiatrist of physical medicine, and basically he's one of the attendings that work on our PM&R floor, and he's going to tell us about the services and the different things that physiatry does and physical medicine rehabilitation does. Dr. Isaacson, welcome today. So why don't you tell us a little bit about yourself, where you went to school, and what you practice?
Yeah, well, I'm a 20-year veteran of the department. First of all, I wanted to let you know
Wow, congratulations.
and I did my residency. Well, I went to medical school at UMDNJ, Rutgers,
Sure.
and I did my residency at in Columbia, which was very fortunate because I had an opportunity to be exposed to a lot of different pathologies and see a lot of very very interesting cases where I learned a lot, obviously. And I also, started at the hospital right out of residency. And I've been, as I said, there for 20 years. And more recently, I've had the distinction of being the associate chair as well, and Lynn Weiss is our chairman. Um, the department is a very comprehensive, full service department that provides some really fantastic rehabilitation services to the community. So, if you have any specific questions, I'd be glad to ask.
No, I mean, I know they received lots of awards, and I mean, you made the top hospital PM&Rs for U.S. News and World Report, and
Yes.
all the docs are top trained. I actually had Dr. Weiss here on the show once before, Dr. Lynn Weiss, and she's the chairman of the department, and she's really an excellent physician and physiatrist. So,
Absolutely.
we have a level 1 trauma. We got a lot of car accidents. We're a stroke center. So if someone in Nassau County has a stroke, the EMS ambulances, the fire departments, or the police ambulance will take them to our hospital because we're the stroke center. We have the equipment, the different types of specialists, the neurosurgeons, neurologists, the neuroradiologists, standing by 24 hours a day for our patients at that hospital. So we get a lot of strokes, we get a lot of car accidents, a lot of patients get banged up pretty bad.
Right.
So now we admit them. Now we do great things, and we check out their chest tubes, and now we put the rods in their spine, and they're able to actually eat and get up. They come now to your floor. What do you guys do with a patient? For example, a trauma patient. How does that work?
Well, first of all, the definition of rehab is restoration of function.
Okay.
And really our goal is, as you had alluded to earlier, is to reintegrate that individual back to their normal life, I mean,
Right.
back into the community. And maximize that as much as possible. So what we do is we really look at a person as, who they were, what happened to them, and where are they going. And with all our services, in conjunction with all the full service medical services that the hospital provides, which makes our program not entirely unique, but unique in a large way, because a lot of other facilities, rehab facilities, are freestanding and not attached to a tertiary hospital.
Mm-hmm.
So we work directly with the other disciplines, the surgical teams, the medical teams, and take the person from their acute period where they obviously need a lot of very very specific, very acute care, to the second phase where they're able to tolerate getting up and moving and tolerate certain therapies. So we provide both physical occupational therapy, meaning we want to restore their mobility and restore their self-care, their ability to get up, move in a bed, get up out of bed, transfer into a chair, manipulate a wheelchair, dress themselves, something as simple as brushing their teeth, of course feeding themselves. So with all of these modalities that we have and all of the different areas in our department, we're able to achieve this goal.
And we have all the resources. So you'll evaluate the patient. You'll go down while they're probably still on the medical floor with the stroke, or in the trauma floor with the trauma, and you'll do a full screening and determine what the status of that patient is and what level of care. So
Yes.
there's a subacute, acute, and chronic. Is that correct? And can you tell me the difference? What's the difference between acute and subacute?
Well, acute is the effects of the initial injury. Where there may be a level of medical instability where the person's blood pressure may not be optimized, or they may not be conscious, they may have fevers, they may have significant blood loss, a lot of things that require very immediate, aggressive medical care, and would also preclude the person from being able to be aggressively mobilized and moved. So that leads us then to the subacute phase when things are stabilized. Person is more conscious, able to communicate. And that's where, I mean, we can come in at the acute phase for very specific things, but really we come in at the more subacute phase where a person is on the mend, stabilized, but requires a lot of other interventions to get them moving.
So initially, if someone's in the medical stuff, medical floor with a stroke, things like swallowing food and speech, is that part of your department?
Absolutely.
Speech and swallowing, they call it, and
Yes.
so you'll send someone down to the bedside to see if in fact that person can eat, or whether they need just clear liquids, if they can eat pureed foods, or what the diet would be for that person. It's so important to get people eating again in the hospital.
Oh, yeah.
You don't want to be feeding them with an IV. You don't want to be feeding them with an NG tube or any type of tube feeding. We used to say if you have a working gut, use it.
Yeah, absolutely.
And so you'll send your people down, and they'll do a complete, and so they'll start at the acute stage already.
Yes.
If they have a hand injury, the occupational guys will go down there, the occupational medicine, technologists, and they'll start working with their hands and their arms to get those functioning as well.
Yeah, I mean, where we come in on a consultation basis initially, a request by the other teams to evaluate this person to give our impression as far as what we can do from a rehabilitation point of view.
Right.
So in the acute phase, what we can do is we could provide splinting, certain types of bracing, recommendations on preventing pressure sores, recommendation on swallowing, and other recommendations just to start stimulating the person. The next phase would be then we need to evaluate, okay, what other therapies can we go to the next level with? And you need to be knowledgeable about things because an individual who is compromised medically significantly, if you push them too hard, of course there can be side effects, and we obviously prevent that.
So now we got them. We think they're stable enough. We now take them out of the ICU or the step down unit, and we're going to move them onto your floor, onto the 5th floor.
Correct.
And at that point, now they really get some intensive. They have to actually be able to tolerate, right? They have to be able to tolerate getting out of the bed, tolerate walking for a few minutes or a few seconds, correct?
Sure.
Because otherwise they won't get any benefit out of that, right?
Absolutely, and again, that's where our expertise come in to determine at what point, of course, along with the other teams, to determine at what point can we then transition them to our floor and then really, get more aggressive.
Get them sitting up, then getting them out of the bed, getting them into a chair, getting them up to some walking with a walker.
Right.
We had a patient, I don't know if you saw in the news last week, who had a diving accident. A young 17-year-old boy dove into Jones Beach, fractured the neck, and the poor kid was paralyzed from the neck down, completely paralyzed from the neck down. They brought him to our emergency department, to our trauma center. Dr. Fontana, who's our neurosurgeon, was able to do surgery, miraculous surgery. And that child is 17, is walking now. And I know he went down to you guys after the surgery, and you were able to get him at least started a little bit. To get him transferred to another facility, which was, I think it was Kessler, which then is one of these long-term rehabilitation centers that really did amazing work with him. And he came back to say hello to us and to thank us, and to thank Dr. Fontana particularly last week. And it really was a touching, emotional moment to see him actually without a walker, walking in and standing at the podium, and they made him stand there for like 15, 20 minutes. I was getting tired standing there, and I asked him, I said, "You want to sit down?" He goes, "No, I'm fine."
Yeah, so, look, there have been a lot of not exactly similar, but cases where over the years where an individual had been so severely injured, and you see them at that point where it's touch and go, and then they come back after what we do for them, and they're completely independent, full individuals. It's a great thing.
Amazing, it really is. And so I would assume that so a patient such as this, we don't have to talk about this particular patient. We get him up out of the bed, we get him into the chair, and then we start doing different types of strengthening types of exercises and different types of things. So what kind of equipment do we use? Do we have bench presses and ellipticals? What do we do with these guys?
Well, in the beginning, it's really simple. It's the therapist, the physical therapist, that is going to really provide I guess the crutch in a sense to get this person moving. So we use devices, walkers, crutches. We use canes, something called a sliding board, which bridges the bed to the chair if a person is very, very compromised and really can't stand, but can find a way to kind of scoot themselves over. And that's where the therapist comes in to determine where we start with them and then how fast we can go.
Physical therapy. So how many hours of physical therapy does someone get a day for these types of treatments?
Well, at the bedside, it's roughly about 45 minutes a day, but on our floor, it's 3 hours a day, actually split into two sessions when you're in the acute inpatient rehab. So it's a full day, and in addition, there are other activities that are interspersed between their therapy sessions. So it's literally a full day, but specifically, it's 1.5 hours in the morning and 1.5 hours in the afternoon of split PT, physical therapy and occupational therapy.
I know you have Wii machines and these Game Boys.
Yeah.
How does that help our patients? I know there's one that have this giant TV, almost like it's a 3D Wii game or something.
Sure.
What's all that about?
Well, that's a really great tool, and it's really helpful in individuals with balance problems, and also shoulder problems, weakness, because what we do is the screen provides a virtual world, and what the individual has to do is try to follow the screen and work on moving from either the right to the left, forward or backwards, to work on their balance, and then also to try to reach out, playing golf, play baseball, simple things like that can work on shoulder problems, elbow problems, hand problems, neck problems. So yeah, these are very, very good tools that we do use.
So interspersed between the actual physical therapy, they'll be doing different things like that to keep themselves occupied, keep their mind occupied, hand-mind coordination, hand-eye coordination, that type of stuff.
Absolutely.
All right, great. How long do they usually stay up on your floor, patients?
The average length of stay is about a week. But it can range depending on the severity of the injury.
And these are all subacute patients?
No, these are acute patients.
Acutes also?
Yeah. The subacute has a little different definition, that it's not as intensive. It's usually geared for individuals who are so significantly medically compromised that they can't tolerate more than maybe an hour a day. Or they are just at the point where they just need a little tune-up before they go home, and don't need that very, very intensive therapy. So there are two, very kind of diametrically opposed reasons to go to subacute, but subacute is really geared for the very, very compromised individual.
They are.
Yeah. They can't tolerate, as I said, a very intensive program.
They can't, so they'll go to subacute. Do we admit subacute as well?
We do not have subacute patients at this time, so we're specifically an acute inpatient rehab facility.
Now, A. Holly Patterson, our sister facility, do they have subacute?
Yes, they do.
They do. So why don't you tell me a little bit about A. Holly? What's I know they continue. It's a continuation. A patient that have had some sort of accident or illness that needs continued physical therapy, either one end of those extremes.
Right.
We could send them there for subacute.
Right, and subacute is really much longer term. Someone who really is going to need a very significant period of time before they may integrate back into the community, and even actually an individual who really can't integrate back into the community and may need long-term care, but you want to get them to a point where they're a little bit more functional, so you would have them go to a subacute, get them stronger, and then transition to a long-term care facility.
So Kessler or one of these other types of facilities, are they also long-term care, or are they subacute?
Kessler has both, but Kessler is more specifically an acute inpatient facility.
Acute also.
Yeah, they are.
Acute. And Rusk also?
Rusk, yeah. But A. Holly, certainly can provide and does provide all the rehabilitation services: physical therapy, occupational therapy, speech therapy, everything that an acute facility would, but at a different level.
Right. I mean, I've been there, and people don't realize. Again, it's another. Oh, we heard of A. Holly Patterson. It's in Uniondale. It's an older building, but yet the care there is second to none. I mean, a couple of they receive 5 stars. They have such great staffing. The patients experience there speaks so highly of the place. Even the food is good, and I go there frequently myself. And we have some really great people working there. And people really don't understand that if we treat you at the hospital and we get you back to that point, we could send you over to there for continued treatment until you're discharged home.
Yeah.
This way, you're still here on Long Island. You're not going to Jersey or wherever the other treatment facilities are. You're close by your family, and you get the excellent care that you need here at A. Halley Patterson.
Yeah, and you have the added benefit if you were a patient in our main hospital, tertiary care hospital, that you were really directly in communication. So all the medical issues are, it's continuity and very good continuity.
Sure, that's true, right? Because the physician, the MD, the doctors are right there.
Yeah.
And if something went wrong and you had to come back to the hospital for whatever reason, you have the same doctors, the same physicians here at the hospital that can take care of you. Yeah, that continuity really means a big thing in medicine today.
Absolutely.
So where are we going with physical therapy? What's the next big thing with orthotics and robotics and all this other stuff? What's happening in that world?
Well, all of the above. There's a lot of rehab technology. I mean, of course, insurance can be an issue, depending on how expensive the device is. But certainly, there's all new types of materials, a lot of different types of devices that we have access to that can really help an individual gain a higher level of independence, regardless of their injury.
I mean, 'cause it's amazing. You watch, what's new on science on one of these Discovery channels on TV, and you see all, unfortunately, we have soldiers over there fighting a horrible battle, and they're terribly injured, and they're losing limbs, and they're, really coming back with a lot of medical problems, physical problems, and so I'm so happy to see a lot of science going into that world. That we're looking at prosthetics, we're looking at bionics, we're looking biotics, rather. They're looking for things that really could help these soldiers. Do we have any? Do you get a lot of them patients here in our hospital? I know we're not a VA hospital, but patients with amputations and things like that.
Oh yes, we do, and we work with a couple of prosthetists, orthotists that have offices in the community. Excuse me, and we're able to provide all types of devices, braces or prosthetic limbs, that will be geared to the individual's lifestyle.
Right. Because that's really the whole idea. Like you said, what is physical medicine about? And that's to get people restored back to their original activity, or close to the original level of activity that they started out with.
Yeah.
So anything that you guys can put together to do that is amazing.
Sure.
And so the hospital itself, what's next? We have an outpatient facility as well. So why don't you tell us a little bit about the outpatient? What happens with the outpatient physical therapy?
Yeah, it's actually a very comprehensive service that we provide for the outpatients. We actually, have a musculoskeletal focus as well as neuromuscular and neurological. So basically, people who have gone through rehab or a weekend warrior hurt their back, we, either the continuum after their discharge from their acute inpatient or subacute stay, or somebody who, banged their elbows, having elbow pain, or strained their neck or their back, or, a soccer player who strained a hamstring. All of these things we can address and we handle.
I know on the ground floor at National University Medical Center. So we're going through a lot of, and like at the beginning of the radio show, I talked about some of the changes we're making. And on the ground floor now we have our primary care center. And when we open up the primary care center on the first floor, all that is going to move upstairs. But physical medicine and rehab is still down there. And they have a huge footprint down there. And you have all sorts of different types of. It looks like one of these gyms that you pay like a top membership for.
Yeah,
and one of these days, I keep saying, one of these days I'm going to go down there and use some of that equipment. That's the state of the art gym equipment that you have down there. All sorts of stuff, and you have physiatrists, and you have physical therapy. You do all sorts of strengthening exercises and reflexes and stretching.
Yep. And also occupational therapy as well, continuing getting equipment for somebody, to help them get in and out of the bathroom, use the bathroom, feed themselves. All these devices, splints, or also we also make and provide too.
What are those giant hot tubs down there? You have a bunch of these giant hot tubs. What the heck are those things?
They're Hubbard tanks. They're called. They're just giant whirlpools, but they're really used for cleansing wounds. burned patients, as well as patients who have very large pressure sores that unfortunately can develop sometimes. So there's a lot of different ways that those hover tanks can be used, and they're very, very beneficial.
Yeah, I mean, they're all metal.
Yeah.
And you have giant lifts with, you can lift like a chair on a hoist that can lift patients up and put them in.
Absolutely.
It's amazing stuff.
Yeah.
So if I'm a regular person, not a patient at the hospital, and I need a physical therapist, can I come to you?
Yeah.
So I can go to New Health and NUMC and park right there and walk right in and get my physical therapy on the ground floor?
Ground floor, Area 7A.
How do I do that?
Well, you can call directly, which is 516-572-6522.
6522?
6522. Rosalie or Cynthia can help you make an appointment. And we have outpatient service, office hours, pretty much 5 days a week. There are a couple of days where we don't, which is Wednesday morning, Thursday afternoons, because we're teaching residents. And that's the other thing I do want to mention about our program, is that we are an academic program and we train residents. So you can make an appointment, and we can certainly accommodate you.
Yeah, I mean, we are a university hospital, so we do a lot of teaching. We have some of the best professors, and we teach the latest techniques to residents.
Absolutely.
And the residents, give us an extra helping hand and really an extra, added dimension with the patients. And so, so what was the number? 572
6522.
6522. Cynthia?
Or Rosalie.
Or Rosalie. So listen, I hurt my knee this weekend. I was out, playing some sports, and it really bothered me. I need some physical therapy, so I can call them up and make an appointment to come see them.
Absolutely.
All right. Do I need to see an orthopedist first? Do I need referrals?
Well, again, it depends on your insurance, of course. Sometimes, certain carriers require a referral first. But basically, depending on what your resources are, sure, you can make a phone call, and we can set you up with an appointment.
Right. So if I go to the ER, say, for example, and they take an X-ray, or they say, okay, it's not broken, doc. You just need some physical therapy. Call this number, and and make an appointment for physical therapy. You can do that to your guys.
Absolutely.
And then we just show up down there, and you guys have a full-service physical therapy facility.
Yes, we do.
And you just do what needs to be done, and you can give me a series of whatever how many treatments that whatever I need, right?
Yeah, and we also can facilitate getting wheelchairs for spinal cord injured patients, patients with multiple sclerosis, things like that, if required. And we also have we also do some procedures, injections, and we also have another unique aspect where we have Dr. Dennis Dowling, who's a osteopath, and he provides manipulation therapy.
He does OMM.
OMM, yeah.
Wow, that is great. I mean, there are very few places in Long Island you can get osteopathic manual manipulation. That's OMM.
Yes.
These are the DOs. These are doctors of osteopathic medicine, the NICOM docs, New York College Osteopathic Medicine guys. Wow, I've never
really skilled guys.
Wow, are they amazing? Their hands they're like they actually find the nerve roots and the muscles and work that area.
They do.
That's one of the things that I promised I was going to do when I took over the hospital, is open up an OMM clinic, and I'm going to do that. As soon as we move that primary care upstairs, I'm going to open up an OMM downstairs, because I think that's an amazing. Those guys are amazing. They really do great work. So,
yeah, I do have a lot of respect for what they do.
Put them together with you and your treatment class, and you put a program together for for a patient, and they're really going to recover very quickly.
Absolutely.
Wow. I tell you, it's amazing. It really is. The things that we have at that hospital, the training, the level of commitment from our physicians and our nurses, our physical therapists, occupational therapists, speech therapists, and the equipment that we have there is just amazing. And a lot of people don't realize that, and that facility is available for them.
Yeah, I also have to say that the therapists are really top notch, as well as the nurses on our floor. So I've seen the whole department over the years really flourish and bloom, and that's why I stayed.
Yeah. You and Dr. Weiss have made an unbelievable department with your team. It's a team. Anybody says any one person's responsible for anything in that hospital is wrong. It's everybody together. The PCA, the clerk, the transporters. It comes down to the dietary. Everything together builds that experience. that patient experience.
Which the patient is a part of. I always tell the patient that you're part of the team too. So everything's on the table, and we all work together.
Dr. Isaacson, it was great having you here. I mean, this is another, fantastic session that I've had with another great doctor. I can't get over you guys.
Fantastic, I'll take that.
No, it's really amazing docs that we have in that place, and it's really not only we saving lives and making, doing miraculous surgeries on patients, but just to get them back up on their feet and get them back out to where they belong, back into population and doing their normal things is amazing. So I'm Dr. Victor Politi. I'm the president and the CEO of Nassau University Medical Center over on Hempstead Turnpike. And I don't know if you can hear my enthusiasm, but this is real. I really feel this way about that hospital, and it's really doing a great turnaround, and we're doing a lot of good stuff. So we're here for you. We're right there on Hempstead Turnpike. I want to wish you all a great day today. Hope you enjoyed the show. And stay healthy. So, goodbye.